Hi, I'm Steve Pod. I'm going to talk about QRS duration as part of the ECG Basics course. So firstly, this diagram here is a fairly crude representation of the ventricle, and at the top we have a green star, which is the AV node, and that feeds into the specialist conducting tissue of the ventricle, which is essentially the left and right bundles of His. And your QRS duration is dependent upon the conducting properties of the bundles of His, but also dependent upon where the origin of the ventricular beat comes from, i.e., in a normal patient, the AV node will depolarize, and that will cause simultaneous depolarization of the left and right bundle. And as they depolarize together, the QRS is sharp and narrow. And the normal value is less than 3 small squares or 120 milliseconds. So when we think about why a QRS may be broad, it's for one of two reasons. Either there is a disease process within one of the bundles, either the left or right bundle, that means that conduction starts as normal, but as it hits the bundle branch block or the disease within the bundle, there is a slowing of conduction, and that normally would cause a notching in the QRS and a broadening above 3 squares or over 120 milliseconds. The other reason why QRS may be broad is that the ventricular depolarization has not started at the AV node. It started in the periphery of the ventricle, and the non-specialist conducting tissue of the ventricle is slow to depolarize, and therefore it takes time before that depolarization will reach one of the bundles, and then depolarization will occur retrogradely to allow the rest of the ventricle to depolarize. So we'll look at those two examples in more detail. Here we have an example of bundle branch block, and what I've done is I've just drawn a red line in the left bundle to represent left bundle branch block. So if we look at the conduction, it occurs as normal from the AV node, usually following a P wave. The right bundle in this example will conduct completely normally, so the QRS will start sharp. However, the left bundle, there is a slowing of conduction, and then this continues, and so the rest of the ventricle depolarizes slowly, and this causes the QRS to widen. So in this example, we'd have an ECG that looked like left bundle branch block. So the other reason that you may have a broad QRS is if the origin of the beat is in the periphery of the ventricle. So in this example, if a patient has previous scar from myocarditis or a myocardial infarction, or even has a completely normal heart but an area of irritability, then a beat can start elsewhere in the ventricle. And as time passes, there is depolarization, but it is slow as it goes through the non-specialist conducting tissue, and hence the QRS is broad. Eventually, the depolarization will reach the bundles of His and accelerate, and the conduction will accelerate throughout the ventricles, but there will be an initial slowness causing the QRS to be over 120 milliseconds. So before we look at some examples, just to recap, a narrow QRS means that the origin of the beat is from the AV node, and the right and left bundle are depolarizing simultaneously, whereas a broad QRS either means that the conduction has started at the AV node but has been slowed by bundle branch block, or the rhythm has started in the periphery of the ventricle, i.e. away from the AV node. So here we have some examples. I'll give you a few seconds to look at this ECG. Hopefully, if we look at the QRS, you will see that from the beginning to end, it is verging on 4 squares, which is 160 milliseconds, which is a very broad QRS. If we ask ourselves why, there is a P wave before every QRS, so this is likely to be a rhythm originating from the AV node downwards, and hence it's likely to be bundle branch block. And if we look at the 12-lead ECG again, whenever there's a broad QRS, I look at V1, and the QRS is below the baseline, which makes it more in keeping with a W. The notching can be subtle, but the QRS is negative, hence this looks like a W. And we often use the acronyms William for left bundle branch block, so W in V1 means left bundle branch block, whereas an M in V1 would represent marrow or right bundle branch block. So this patient has left bundle branch block. Here's another example of a broad QRS. There are some other conducting problems going along, but concentrating on the QRS, hopefully you can see that again it is just over 3 squares, so between 120 and 160 milliseconds. And if we look at V1, the key feature is this is more of an M shape. So this is a right bundle branch block that has caused a broad QRS. In this example, if we look more closely at the rhythm strip, hopefully you can appreciate, if we bring it up close there, that the P waves are completely dissociated from the QRS, and therefore this is third degree heart block or complete heart block. But also the rate is slow, but the QRS is broad. And if we look there, the QRS is almost over 5 squares, so over 200 milliseconds. This would be a very broad QRS. And that represents the rate. And then here we can see all the P waves that are marching through. So the reason this patient has a broad QRS is because there is complete AV dissociation or complete heart block, and hence the rhythm is not originating from the AV node. The rhythm is originating from the periphery of the ventricle, and it takes time for it to depolarize until it reaches specialist conducting tissue. Hence the QRS is over 200 milliseconds. This would be a worrying ECG to see because they have complete heart block with a very slow, broad QRS escape rhythm. Those are the kind of patients that are more at risk of the heart stopping and dying. Here we have another example of a broad QRS. This time, hopefully, you can appreciate that the rhythm is fast. It's going at about 150 beats per minute. And the QRS, again, is broad, measuring, again, 5 squares, so about 200 milliseconds, so a very broad QRS. This is very likely to be ventricular tachycardia, and the reason the QRS is broad is because the rhythm is originating away from the AV node. So the reason the QRS is broad is the same as complete heart block, but in this case, of course, the rhythm is much faster. Again, an emergency ECG must be recognized and treated quickly. So this is the final example of an ECG with a broad QRS. Just give you a few seconds to look at it. Hopefully you can appreciate that there is a P wave before every QRS and that the PR interval is short, which is very suggestive of an accessory pathway. Now, accessory pathways cause the PR interval to be short, but also they feed into the ventricle, not away from the specialist conducting tissue. So it feeds into non-specialist conducting tissue of the ventricle. Hence, there is a slurring of the QRS as conduction is slow to begin with once it gets to the ventricle. So a pathway allows rapid conduction to the ventricle, but then the conduction is slow because it is away from the bundles of His. Hence you have your delta wave. And if we want to take that slightly further, if we look at V1, hopefully you can appreciate it has an M shape, i.e. it's above the baseline, and would fit more with a right bundle type picture. What this means is that the accessory pathway is feeding into the left ventricle, and hence the left bundle is activating first, and the right bundle is activating later. Hence it looks more like a right bundle branch picture. So this ECG shows a short PR interval with a slurred QRS, which is broad, and a right bundle type morphology. So it's very likely that that pathway is on the left side. So just to summarize, when looking at a QRS, if it is a narrow QRS, i.e. under 3 squares, this indicates ventricular depolarization from the AV node or just around the AV node downwards, and therefore is depolarizing the left and right bundle simultaneously. If you have a broad QRS, you must decide whether it represents depolarization from the AV node downwards but is hitting diseased bundles, or whether there is a rhythm originating from a different location within the ventricle, either non-specialist conducting tissue. Okay, hope that's been helpful. Thank you.